Hello, my name is Dr. Emelia McCuen, and I serve as an assistant clinical professor at Bowling Green State University School of Physical and Occupational Therapy. Today, I am honored to share our recent work with you on behalf of my co-authors, Dr. Evan Petersen and Dr. Jennifer Kish, who are also faculty at BGSU. Our clinical perspective article is entitled Application of the Severity, Irritability, Nature, Stage, and Stability, also known as SINSS, clinical reasoning's construct to cardiovascular and pulmonary practice. Our work builds on a previous publication in 2021 on the SINSS framework by Dr. Evan Petersen and two other colleagues. The article came from an orthopedic manual therapy background and provided a systematic way for clinicians to better evaluate patients' symptoms and guide examination and treatment decisions. This framework also facilitates a deeper understanding of the patient's pain experience and assists clinicians in identifying the predominant pain phenotype, nociceptive, neuropathic, or nociplastic, within the patient's presentation. In this article, we built on that foundation by exploring how the SINSS framework can be applied in cardiovascular and pulmonary, or CVP, physical therapy. Clinical reasoning in CVP is both essential and highly complex. Our patients often present with multiple interacting conditions, and as therapists, we have to integrate cognitive skills like data analysis and hypothesis testing with non-cognitive skills such as active listening, critical evaluation, and reflection. Even with experience, errors in reasoning can occur if we don't have a structured evaluation approach. That is where the SINSS framework becomes so valuable. By applying the 5 elements of severity, irritability, nature, stage, and stability to cardiovascular and pulmonary conditions, we can gain a clearer structure for decision-making and patient management. Here's how it works. Looking at severity and irritability allows us to gauge how vigorous or cautious our examination and interventions should be. Understanding the nature of symptoms ensures we remain alert to underlying pathophysiology and risks. Considering the stage of the condition helps us to match our care to whether the patient is in an acute, subacute, or chronic phase. And evaluating stability helps us determine how safe it is to progress or modify a plan of care. This systematic approach helps us avoid pushing patients too far or, conversely, missing important findings because we under-evaluate or under-treat. Ultimately, it leads to a more individualized, safer, and more effective intervention. In our article, we also discuss how SINSS can support education in cardiovascular and pulmonary physical therapy. By teaching students and clinicians to use a consistent framework, we reduce diagnostic, prognostic, and interventional errors, and we create a shared language for reasoning through complex cases. In addition, the construct encourages learners to engage in reflection on action as they critically evaluate decisions afterward to inform future practice, as well as reflection in action as they adapt reasoning during patient encounters. For me, one of the most exciting parts of this work is that it bridges a gap. It takes a framework that has been tested and trusted in orthopedics and shows how it can enhance reasoning in cardiovascular and pulmonary care. This is a setting where clear, systematic decision-making can truly make a life-changing difference. On behalf of my co-authors, I invite you to read the article, reflect on how SINSS might inform your practice, and join us in advancing clinical reasoning in cardiovascular and pulmonary physical therapy for the benefit of both learners and, most importantly, the patients we serve. Thank you.